Well, welcome everybody back to the 39 Gen podcast from Yosan University. I have a really awesome guest with me today, and I would just like to tell people who you are and a little bit about what you do.
Sure. My name is Laura Erlich. I'm a doctor of traditional Chinese medicine, an acupuncturist and an herbalist in Southern California, the Los Angeles area. And I specialize in infertility and obstetrics. My background, I started as a birth doula and a body worker, and then eventually turned to acupuncture. But it's kind of always been through that same lens of working with women along the childbearing cycle, one way or another. And I have been teaching since about 2012 now at Yosan, since 2016, I think. So I have been part of the DAOM program for almost 10 years. And I also teach a mentorship on healthy seminars. A lot of that information that I offer doctoral students is also offered through healthy seminars. And then I have a clinic here in LA called Mother Nurture Wellness. So I'm
That's
a busy
awesome.
gal.
You are busy. That's a lot going on. But it sounds like you had a really interesting beginning, working as a body worker and a doula. But can you take us back to the beginning and what first drew you to acupuncture and Chinese medicine? What pulled you in the door?
I mean, I think I got pulled in the door actually when I was quite young, a young child, because I grew up in a household where my father became sick with Hodgkin's disease when I was 6 years old and was dealing with one health ailment or another really throughout my entire childhood. And I have recollections of him, like going to acupuncture, saying he was going to acupuncture to deal with the side effects of his nausea or he had like very, very severe side effects to the chemotherapy treatment that he was given in those days. And so my parents were extremely new agey. And so we went, to like family retreats where we were doing meditations and we were learning about the chakras and learning about auras and, hands-on healing stuff to some degree, like very minimal, but like healing circles, I guess is a better way to describe it. I don't want to sound like it was not anything kind of evangelical. It was truly a secular kind of a thing. So that was sort of my upbringing. I was sort of caught between both worlds for much of my childhood and into my adult life, where I was around people using Western medicine and needing Western medicine with really no other alternative. And at the same time, turning to Chinese medicine and other types of, holistic and kind of complementary strategies to cope. So that has been in my life, my whole life, I guess I would say. What drew me to it personally was that, as luck would have it, my mother also got cancer when I was in high school and passed away. And then my father came out of remission, like very shortly after she passed away, had to undergo a bone marrow transplant, and he passed 4 years later. So my entry into adulthood was, am I allowed to cuss on this podcast?
I have no idea. We can beep it if we need to.
Because I can. Anyway, what I was going to say, honestly, my entry into adulthood was kind of fucked up. Like it all kind of went down for me at the end of high school. My mom died at the end of college. My dad died. And I found myself in the world reeling in terms of like, I just needed to get my feet on the ground. And at the time, my undergraduate was so far from Chinese medicine. Like if anyone ever told me what I'd be doing today, I would have been like, what? Not a chance. But my undergraduate degree was in theater and English literature, and my like great passion was Shakespeare. So I was living in New York and like wanting to pursue doing theater and taking acting classes. And I decided to go to massage school because it seemed like a better solution than waitressing. Even though waitressing was super fun, I felt like in the long run, this might drive me crazy. And I was ready to find something that felt like a job that could coexist with my desire to do theater, which pays, very little, if at all. And at least at that time in my career, that was the case. So massage school was sort of like, it was sort of with a different intention that it ended up being. And then I
Okay.
went there and it actually became the catalyst for my own healing, and all the grief that I had been carrying and the extremely dysregulated nervous system that I was walking around the planet with. And so that it was really learning through what actually was possible in a sense, like I had been suffering from severe GERD that was excruciating. Acupuncture like took it away. I mean, for a while, eventually that didn't, came back in my life, but for quite a long time, it helped me deal with that. And I interestingly enough, and this is also just one of those like life is so coincidental. I was going to, or whatever, coincidental or destined or whatever it may be, but I was going to I was attending the Swedish Institute of Massage in the 90s. And Jeffrey Yuen was running
Mhm.
the acupuncture program there. And I had no idea at the time, but now that I think back on the treatments that I received, like they were doing secondary vessels treatments on me. That
Mhm.
was actually my real entree into Chinese medicine, and it brought about profound healing for me. But it really wasn't until recently that I put it together that I have then gone on and been so drawn to working with the secondary vessels and the eight extras in particular. And it's become such a big part of my practice. And then I just realized not too long ago, like, whoa, I bet that that's how I was being treated. I mean, they were his interns. So I don't think they were doing, straight up Zongfu acupuncture on me very much. They were regulating my nervous system. And that has been essentially what my journey and my career, I feel like, has been about, is learning how to regulate my own nervous system and helping my patients to regulate their nervous system so that their bodies can do what they want them to
I
do.
love it. I love it. And it's like so many people find this by seeking out their own healing, and I've interviewed quite a few people now who had, traumatic events that then drove them forward. I remember that when I was in school, one of my classmates, he was a Vietnamese kid and he was there because his mom was in kidney failure. And he said, you know what? I'm here because Western medicine is great, but I'm doing everything I can to supplement and support her as well. And he was a kid who, um, the schools had passed him over, and he was not the smart kid. And he said that himself. He's like, I'm not the smartest guy, but I'm here because this is more important to me. This is, he says, I'm going to work harder. And he put in the hours. He studied so hard. And now he's an absolutely amazing acupuncturist in San Diego. And, and through this whole time, he's been one of the people that supported his mom more than anyone. Luckily, she was able to get some help and get some treatment, and she's doing
Mhm.
much better. But his treatment was a foundational thing to part of her healing, and it's personal when you've gone through things or you're dealing with things. But was there a pivotal moment that confirmed for you that this was your life's calling? Was there like one moment where you're like, yeah,
There
that's it?
actually was. Um, so I grew up in Los Angeles, but I had moved to New York after college for a while and then decided to move back to Los Angeles. I came back with a massage license essentially and with a really deep interest in birth work. So I had started apprenticing with some midwives in New York, but I hadn't really gotten that far with it before I decided to come back to LA. When I got back to LA, I just started doing all the things at once. I was doing regional theater. I was doing massages. I was running a yoga studio massage program. I was building a house call practice. I was also attending births. Like I started getting that going. And I woke up one day, and this was, that all of that to kind of become busy enough to actually be, each individual things be overwhelming took about, I would say, like 2.5 or 3 years from when I arrived back in Los Angeles. And I remember distinctly waking up at the end of a season, a summer repertory season of theater. I'm thinking to myself, like, I'm not doing any of this right. Like, I'm exhausted. I'm stressed out all the time because I think
Yeah.
someone's going to go into labor and I'm going to be like on stage while someone's 911 calling me to come in an emergency or whatever. And so it was just like a switch went off and I was like, okay, that's it. I'm going to go to acupuncture school. And that it literally was it. Like, I really only recently have thought maybe I would like to go back and like take a scene study class or something again. But this, it's so, I think it's, just about like myself and the way my brain works pretty interesting just because my dedication to that was so to the theater, to like being a, a stage actor, not necessarily like in Hollywood, but literally be a stage actor I was so driven towards that in a way that felt like there was no other option. And then when the day came to stop, I was just done. I just stopped. I don't know. Like I just pivoted and decided that Chinese medicine was going to be it. I do think, and I'm very grateful for that background because it has made it easier for me to teach and speak and, write a book and do things that I think a lot of folks are understandably really, just it's not they don't have the experience in it. And they're not going to necessarily start now and stand up and say, yes, I'm not afraid to tell you what I think about this. That's just, it's part just who I am. But I do think a lot of it is also that I had that experience of wanting to be a performer or being a performer for so long. I mean, I was 30 when I started acupuncture school. So I had been living that life really for, you know, I mean, including when I was in university, but I was performing all the time then, like, 13 years of continuously being in the theater all the time.
Yeah.
Yeah.
You specialize in fertility and attend births as a doula. I mean, how did that niche become your passion? How did you get into that?
So when I was attending massage school at the Swedish Institute, the word doula was just entering the American vernacular in any sort of
Mhm.
like a real mainstream way, just on the edges of it. But it just so happened that three of my teachers were doulas. Two of them were studying now then to become midwives. And I was just immediately drawn to it in kind of in the same way that I feel like I sort of shut the door on, I'm done with acting. No, bye. It was like, oh, I'm going to do this. It was not, people always ask me how I got into it. And my answer is that it got into me. Like I didn't even, I didn't even second guess it.
Yeah.
And I certainly have looked back and gone, why was that such a drive that was going to be it? I mean, I hung out my shingle as a pre and postnatal massage therapist. I wasn't a general massage therapist. Of course, I had to do some of that at the beginning, but that was like never the plan. Um, and I became a doula within like months of finishing um, massage therapy school. So I think I can psychoanalyze myself and say I wanted to work in birth because working in death was just, or in around people who are going to die was not something that I was able to contemplate at that stage of my life. Uh, I've now come to understand that it's really the same door, kind of the same portal. It took me a long time to be able to even consider working in that space at all. But I'm right now doing a Taoist death mentorship program with Randy and Lewis. And I am not necessarily saying I'm going to change my specialty or start working with people in hospice care, but I'm for the first time maybe capable of considering incorporating people who have more going on than just fertility
Mhm.
and pregnancy into my practice in one way or another. I'm not sure yet, but I think that it largely happened because the opportunity was just there and it was
Yeah.
new and there were a lot of people who were really excited about the idea of it. And then I think that my personal mindset, which again was really from goes way back to my childhood, that you don't use Eastern, Western medicine or Western medicine. Like, you use what you need when you need it, and you kind of manage your life without judging what you need to help yourself be better. And so I think that made me sort of popular with the OBGYNs in my community. So they
Yeah,
started referring me, and like once that happened, then I was very busy.
that's awesome. Now, how do you see Chinese medicine supporting individuals and families like through the entire reproductive journey? From
Yeah.
conception to postpartum. How can Chinese medicine support these people, both the fathers, mothers, and everyone else around?
I mean, it can, in such a profound way, it can support every phase of the journey. When we're talking about, I mean, from a fertility standpoint, there's sort of two tracks. There's people who are proactively wanting to prepare for conception and don't have any known fertility challenges. So they kind of come in on one path, and that's really what I call the zero trimester, where we're just trying to get the body ready and get as replete as possible with nourishment, um, get into the right patterns of sleeping and you know digestive stuff, like making sure you're having a bowel movement every day. We'll talk about nutrition and how you're eating now should reflect the way you'll eat when you're pregnant. Like, I don't think we want to see huge shifts. So that's a sort of like conscious conception or zero trimester or preconception phase, which
Hmm.
we generally refer to as being about a 3-month process, because that's the length of time it takes for an egg and a sperm to go from early phases to being mature.
Mhm.
But then once somebody's pregnant, there is, I think, a lot of confusion. A lot of my patients think they have to stop coming right away, like it's not safe or something once they become pregnant. And I'm like, if we got you here, I think we can keep it going. Um, so I refer to that as parallel prenatal care or holistic prenatal care, where with the exception of fertility patients who are receiving prenatal care literally from you know, from like day one of their previous cycle. So I see them very frequently, like at least once a week, all throughout the first trimester. And then we kind of start to spread it out. And for others who are, conceiving naturally, they're not even going to go see their doctor until 8 weeks. They don't need to come in quite as often unless they want that support or unless things are changing. And then I just try to see my patients on the same schedule that they're seeing their obstetricians, basically, so that they know, like, okay, this is because it spreads out to like 4 weeks apart, essentially. And pregnant people aren't sick. They don't need to come to
Yeah,
acupuncture every single week. They should go out and live their lives and be happy and come back when they feel like they want to, or by 4 weeks. That's sort of how I phrase that. And then in the third trimester, we bring it back together, and I'm seeing them every week, if not, several times at the end, trying to kind of get things going. And then in the postpartum phase, I mean, both mom and dad need support in the postpartum phase, but one of the best ways to support the mom is to help regulate her nervous system so that she is able to meet the needs of her baby without also like biting her partner's head off or being super irritable, or just trying to manage that. It's not just the postpartum anxiety or depression that happens in a clinical way to a percentage of people. It is just profoundly stressful, no matter how much money you have, support you have, you know and then it gets harder as those things start to wane. But I think that the postpartum phase is ideally met with going to someone's home in the first few weeks when possible, and I
mm,
do that as much as I can. Actually was with somebody just this afternoon for that
that's awesome.
purpose. So, yeah, just so it changes, but there's a role all the way through, and there's a huge role for men as well, not just in the preparation for pregnancy, but also in keeping themselves regulated and keeping themselves engaged and prepared for what's coming. I think
Yeah.
I was just talking about this with my patient today at her home. They're at they're at day 28. They're still at the part where they're counting how many days it's been going on for, because it's so intense at the beginning.
Yeah.
And
Super.
what's that?
It's super intense.
Super intense. It's no joke. And we were just talking about, like, you can't prepare for it any
There's
better than
nothing
you
you
can
can do.
prepare for what contractions are going to feel like until you're living it, until it's your reality. It's impossible to prep. And so the more people you have to call into your circle for that support, the better. And so that's the role I like to play. The doula and me, like, I can't quite let go until everybody is good postpartum.
I love that. Well, you bring up emotions, and I think that emotions are something people don't talk about enough when it comes to fertility. Talk to me about what role do you think emotional elements play in fertility, and how do you support patients through those layers?
I mean, I think that the emotional elements are almost the most central, especially it's like the more complex the circumstances become, whether that's discovering that something is going on, like endometriosis or low follicle count or a sperm issue or whatever the case may be. It's like the more layers get added on to the situation, the more stressful it becomes. So the Harvard Mind Body Institute did research many years ago. Alice Domar sort of ran their mind body program,
Yeah.
and they did a whole research kind of study into stress related to fertility in particular. And then Alice Domar is kind of a pioneer in the field of stress management for people going through fertility. And what they concluded from this data was that going through a protracted fertility journey or struggle is as stressful as having metastatic cancer, heart disease, or HIV.
Wow.
So it it is just impossible to maximize. I don't know. It is impossible to adequately state how stressful this process can be. Uh, if any of my students are going to listen to this, they're going to laugh because I know I say it all the time, but we only have two imperatives in our primal brain. One is to survive and the other is to procreate. Like the primal brain does not care about any of the rest of it. They just want us to replicate ourselves but first not die before that can happen. And so when that imperative becomes threatened or downright thwarted, it's devastating. It's devastating on a deep cellular level, on like a profound DNA level that one might not be able to replicate or carry on their own family line. And so the pain around that it's not just profound, but it's like gnawing. It never
Yeah.
goes away. It's just this like ongoing constant conversation. So in Chinese medicine, that translates to the spirit of the spleen just becoming profoundly exhausted through this process. It can't assimilate anymore. It can't
Yeah.
take any more in and transform it into anything useful. And so what Chinese medicine, what acupuncture and herbs and in large part nutrition have to do in this scenario is to first of all take away the stress that comes from having a dysregulated diet and uh, and a dysregulated blood sugar, right? Like I work with
Mhm.
all of my patients to say the stress response comes from different places, but one of them is hunger.
Mhm.
And so if you let yourself get too hungry, you're going to end up with too many stress hormones in your body because your body responds to hunger by releasing cortisol. So it can force then your liver to drop some more sugar into your bloodstream. And then you're going to feel more hungry and then you're going to eat more food. And it's just a vicious cycle. So getting in a place where those hormones, those baseline survival hormones are being managed by eating at correct intervals, which
Mhm.
is what the spleen loves, right? Like routine and knowing that meals are coming and in a reliable sort of way that the brain isn't wondering, like, are we going into a famine? That's why I don't do things like intermittent fasting or, you know, any kind of real meaningful caloric restriction when you're trying to get pregnant, because we have to tell the brain that it's okay to
Yeah.
it's okay
You
to become that vulnerable to
yeah.
carry a baby. So so that's the first place. But then the rest of it is really through acupuncture, herbs, and working through the mind body techniques, either with me, or oftentimes, I'm co-treating with the therapist so that they're able to manage, and that both partners have to be acutely aware of this, and often will both need that support,
Yeah.
because it's not, the imperative is no less intense for the male partner as it is for the female partner. The female partner is just often feeling the weight of time
Mhm.
in a way that men don't generally feel as much. Now, certainly in the case where it's a male partner who has azoospermia or has some, other condition that's preventing them from naturally conceiving, they're feeling it in the same way that a woman would as well.
That's so fascinating. But I'm still like fascinated by your story about being a doula, and like how has being a doula informed your practice as an acupuncturist and vice versa? How do these two play into each other?
It has it has profoundly, profoundly impacted my practice. I mean, I was attending births. Well, I still do periodically attend births, but I was attending births in a very full-time way all through acupuncture school. Like somewhere, like I was somehow going to school and doing like up to 5, 6 births a month at times.
That's wild.
Um, it was crazy. It was very crazy. I was very young and willing to burn my jing, I guess. I don't know. Um, but it it informed me on every level, and over time, I would say being in labor and delivery with people has taught me humility
Mm,
on a level that I wish. Hmm, you can cut this part out if it sounds too mean, but that I wish more people in our field had. That I I see so much within our field, this pushback against modern medicine and the
yeah.
need for modern medicine, while they sit on their cell phones, yelling at people about how we don't need modern medicine. Okay. Um, but it's because they have not yet been humbled by either injury or a near death experience or a loved one around them truly suffering in a way where Western medicine saved their life. And all that
Yeah.
I can say is that as a doula, what I witnessed again and again and again was acupuncture is amazing for helping to move labor along. Acupuncture is amazing for helping to regulate blood pressure up to a point, but it should not be in lieu of any necessary intervention. Um, Acupuncture can sometimes help to calm the shen a little bit, but most of that really takes place in early labor. But once a woman is in active labor, then it is up to the Tao what is going to happen here. It is
Yeah.
not up to any one of us to say that it is right or wrong how this goes down, because women used to die all the time in labor. And now, while in the United States, we still have a pretty dismal record around maternal deaths, they are prevented, by, I don't know, hundreds of thousands of deaths a year. I don't know what that would be adjusted for, but um, it didn't used to be a celebration when a woman was pregnant. It used to be that everyone was praying and grabbing their rosaries and hoping that she would survive another one. Maternal hemorrhaging, cholestasis, you know, causing stillbirths, babies not being able to make it out of the birth canal because of the position that they're in. There are things that happen in childbirth that are life or death. And when I see people kind of thumbing their nose at Western interventions and saying, no, I have Chinese medicine, I don't need Western medicine, honestly, it makes me want to lose my mind. So I'm like, you tell that to the woman who's like bleeding out on this hospital table right now. I'm standing here watching it. Yeah, what are you going to do? You're going to moxa liver one? No, you're going to give this woman some iron pitocin. Like, you're going to rush to save her life and stop her hemorrhage. And I don't think that there is a female doctor from the classical times, from in history, who would argue against the value of an intervention like, something that stops bleeding in labor. That would be like, no, 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 we're going to maxa. No, 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 we're going to make this person, like, I don't know, down a fried placenta real quick. That's not, like, we don't need to do that anymore. Sometimes emergencies are important, and I mean, sometimes Western medicine is necessary in order for our survival, I guess. That's the big lesson I think I've learned again and again in labor, and to treat every birth with a great deal of reverence, and that, like, the goal is for a healthy mother and a healthy baby on the other side of it. And we want everyone to feel empowered and autonomous. I do, and want them to feel like their birth experience was their own. But, like, that doesn't mean that if it ends up with that she needed an epidural or a C-section, that she did it wrong either.
Yeah.
And so there's just so much judgment in the wellness space. I like to put the wellness space in air quotes, honestly, at this point, because I feel like we have been sort of taken over in a way that feels really culty to me. And um, I'm not really sure how I got here, but thank you for coming to my TED Talk. I don't know what I did.
I'm going to pull it back in because it was awesome and definitely not getting cut, because it's definitely something that needs to be talked about. And I think this is something that Yosan is definitely working to step into with the DAOM program. Is very much an integrative program. It is merging the best of both East and West. And this is the thing that I've noticed it as well, that, as being a student, there has become this influx of, and not at Yosan, but in the wellness community, about people who are just sharing information, but it's not necessarily
True
or right or correct information. Like, I'm going to step away from just the acupuncture community and talk about this is in general. There's this one guy I follow. I think his name is Mitch something. And I follow him on Instagram, and he's awesome. His page is awesome. And he sits there and he debunks fake things on the internet. And, like, that's his thing. And so yesterday he's sitting there, and there was this lady who's like, I know there's so many AI images online, but this one is real. This is a man who's actually walking on water in China. And it is obviously an AI image. And Mitch just cuts in and he's just like, no, it's fake. It's obviously fake. And I think that, like, people have started to share things without really diving deep. Just this morning, I had a podcast. I do multiple podcasts, but I was doing a podcast with my daughter's channel, and it was for our Ilani's Little World page. I'm going to plug that. I never do that, but we have this other, and it's for kids. But I also have my podcast, the Sean Trey Show, and I had this guy on there named Maynard, and he's the hip hop MD is what he's called, and he's a science communicator. And he was talking about how, we have to seek out things and share things that are true, and that there is objectifiable truth that we can get to, and that we can, and it's about, like, looking at things with a perspective that is this actually real? Is this a thing that is a thing? Because sometimes, there are old ways that are good, but if you could go back in time and give modern science to these ancient doctors, they would embrace it wholeheartedly. They'd be like, this is phenomenal.
Yes.
They would be like, what?
That's exactly my point. And even they were trying, like, if do you know what variolation is?
Yeah.
Where, they were trying to figure out how to inoculate people long before we had traditional vaccines. They're running around with, ground up smallpox scabs and giving people a little cut in the arm and sticking some in there, or they're snorting them up their nose or whatever. There was already an understanding in ancient China about, and I feel like this was also Chinese medicine 101, and that it's somehow been lost in the current rhetoric. Some pathogens are able to overcome their host. Like, period, end of story. You can be the healthiest human on earth, certain pathogens will still get you and could kill you. And so I feel like that's been well understood through history, which is why we have so much historical data about things like the Black Death and smallpox and, all these horrible plagues that the science community has dedicated like generation after generation to getting closer to stopping people from having to suffer from these things that have not just killed a lot of people, but like destroyed societies and destroyed families and upended cultures. And somehow we've lost that piece and shifted the narrative to this place where it's like it's a binary proposition. It's
Yes.
like you're pro Western medicine or you're anti Western medicine. If you're a wellness person and you're pro Western medicine, you're a pariah and you're a hack. And that's really truly what I get called. And I don't care. Like I'm like, go ahead. I'll be here
Yeah.
later. Talk about it again when you come around. Like whatever. Because I'm not gonna I agree. It's like that. I feel like we all have to get into a little bit of good trouble right now, right?
Yeah.
That's the assignment. And we're in the United States, we're in a lot of big trouble. And so I cannot sit here and I mean, I can't, I choose not to sit here and watch people in my profession go down these rabbit holes of misinformation and not say anything
Yes.
about it because it to me it's like now you're imperiling my standing in the world,
Hmm.
my expertise. If you are going to believe all this garbage without verifying it, if you're not going to go
Yes.
and at least probably learn how to read a research paper
Hmm.
and know how to interpret it and know how to look up authors and sources and verify that what you're spewing out is actually has any merit, it just makes all of us look so bad. And so
Yes.
that's the part that just guts me. Not for myself personally, but like I really have devoted my career to building bridges with Western doctors. And I just find it really embarrassing. And they're like, yeah, so and so from your field, I try to have a conversation with them about X, Y, or Z thing, and they just like roll their eyes about it or whatever. How do we build bridges with what is, whether anyone likes it or not, the established norm? Like Western medicine is not going anywhere. Modern medicine is not going to bow down to going back to Eastern strategies as a primary forward way of treatment in the West. So how do we integrate rather than push back and say, you guys are doing it wrong? What about like, yes, and I see what
Yes.
you're doing. I think I could make it better by incorporating these things into your patients' routines. And
I
that
love
is where
that.
fertility medicine, I think, has really also been a place where that particular paradigm has been possible in the
Hmm.
US in the last 20 years. And I do feel very fortunate in a kind of right place, right time kind of way around that too. Because right when I was starting is really when fertility as a specialty was starting to gain traction. So I kind of got lucky twice. I feel like with the doula thing and with the fertility acupuncture thing that as a as a modality people were seeking out, it was starting to gain traction right when I started, and there weren't that many of us. And so now we've become sort of the crumbs of the community, and we're all blabbing about it all the
Well, then that's awesome, actually. Well, but let me ask you this: what I love that rabbit hole that we went down because I think it's something that needs to be talked about. But
time.
shifting it back the other way, then instead of being the reaction to what's wrong right now, what about what's your vision for what truly integrative birth support teams could look like? I mean, including Western med, acupuncture, and doulas. What's your vision for that interplay?
Specifically around birth or around the whole fertility
The whole
process?
thing is fine too.
Well, I mean, I think that first of all, accessibility is a huge issue, right? It's for a lot of people, Chinese medicine is out of reach. In Los Angeles,
Yeah.
we're super lucky. We have the Yosan Community Clinic and some other Chinese medicine schools around where people can get care if they are unable to afford going to see a practitioner in private practice. So that I think that that's one variable there. But I think once people are certainly at the stage of, needing to go through IVF or discovering that they have something going on like endometriosis, which unfortunately, for better or worse, I am usually the person who diagnoses endometriosis in a patient's life. Like they will come
Mm.
to see me and they have been gaslit and ghosted for years and, 8, 10, 12 years about their pain and their issues. And it's only until they suddenly can't get pregnant that everything comes into focus. And then they come to see me and I'm like, this is what is unfortunately, I think, going on with you. So a lot of what I train my students to do is actually really recognize through our unique way of doing intakes, the signs and symptoms of endo and how to help patients discover, get on the right path with stuff like that. So from a fertility standpoint, ideally it's just kind of a collaborative care thing. Um, it's easier said than done. I've again been quite fortunate that I have some doctors in my community, and some of it's just my personality too. That like I'm not afraid to necessarily reach out to them and say, "Hey, I'm looking for a doctor that I can send patients to, who doesn't think I'm a quack, who's going to speak to me, who can look at the data that I have to offer, and show you comparatively how I think I can benefit your patients' lives." And even so, in this huge city with tons of REs, like I've got like maybe 4 people that I can confidently reach out to.
Mm.
And that's almost 20 years into practice, in private practice by myself. Um, so that's tricky. But the more we can have continuity of care, and a doctor reached out to me the other day and was like, "This is my treatment plan. Does that coincide with your thought pattern? And what are you going to do?" And, it was great. We had a great conversation. That is the first time in a long, long time. He was actually interested in what I thought of what his plan was and how I was planning to support it. So I would love to see more of that. But some of that has to come from reproductive endocrinology wanting to collaborate. And that
Mm.
only comes from, I think, acupuncture is actually referring like we have to refer to them
Yeah.
and then stay in touch about our patients with them, point out to them when the things got better, until they start to realize it. And then they send someone to you. And then you send them back and they're like, "Oh my God, they responded so much better this time." Right. Because I got them sleeping and eating and pooping and, taking herbs and calming down a little bit and they're feeling better. And now this is going to work better. Like it's not rocket science. Like
Yep.
I help you feel better so things can work better. And whether that's
100%.
extrinsic medication or internal function, that is, I think, what at least the acupuncture piece has to do with it all. And then the internally things getting better is the nutrition and the herbs, and the psycho emotional support, which somewhat comes from acupuncture, but sometimes we need more. So in the birth setting, I mean, throughout pregnancy, again, I think ideally people would be able to consult with their holistic provider and their PCP on roughly the same schedule. Um, I see that benefiting my patients tremendously, and even patients who I'm concerned about having, high risk issues arise. Frequently, they don't. Like I just have a really super healthy pregnant patient population, and I really think that acupuncture plays a huge role in that. Um, just their regular kind of touching into feeling their own chi, their parasympathetic nervous system being the dominant thing. And I just keep working with them on that throughout the entire pregnancy so that by the time birth comes, they're not overcome by it. They're not completely unprepared for the stress that will arise. And to that end, I mean, in an ideal world, everybody deserves a doula because doulas
Yeah.
help to bridge that kind of help to kind of walk you into the unknown of it all and navigate the part where you hit the rapids, where suddenly it's like you're not necessarily in control of it anymore. It's going to go how it's going to go. And sometimes you end up a little bit on defense or you're just trying to like get somebody through the process without things going really sideways for them. And that means listening to the doctors sometimes. or doing what they say. But it also means saying, okay, but can she take a shower first? Or could we get some
Sure.
juice? Right? Like, it's not saying that what you're doing is wrong and evil and you're just trying to coerce my patient. It's just saying, like, maybe we can slow this down a little bit and make sure that they feel better. So I don't know if that's answering your question, because it's a big question to answer in a short time. Like,
Right.
it's a broad sort of sweeping change that would be in order. It's very hard to see how that happens, I feel like.
Let me ask you one last question. What do you wish more new acupuncturists knew stepping into this field?
What do I wish more acupuncturists knew that what?
Uh, what do you wish more new acupuncturists knew when they're getting into this field?
I wish they knew that nobody's gonna give them a great job, most likely, and that they're gonna have to kind of make it for themselves. That they should be not. That's not to say that there aren't great employers out there. There are, but more often than not in our field, I think people get really disillusioned by the business side of things, and that
Mm,
they really go out unprepared. We unfortunately don't have the structure that Western, medicine has, with residencies and internships and rotations and all of this stuff. And I wish that we did, but in this country, we don't at all. And so people are sort of feel very thrown to the wolves. So, connect with other acupuncturists, try to work in an office with multiple practitioners at first, see how other people are doing things. And, be prepared that it takes a while for things to really build up, and try not to get discouraged. You have to um, just, find where your passion is and keep going. And I think that is the thing that people come in the least prepared for. And also to not, um, just don't come in with any kind of hubris. There's so
yeah.
much to learn this far into the field, this far into my career. And I just feel like I'm barely skimming the surface, like it's the best thing about it. It's a never ending opportunity to keep learning and keep growing. So you can't eat the elephant all at once, just one bite at a time. But buckle up at the beginning and be
Right.
prepared that well, it's not necessarily for the faint of heart to start a business, let alone a business with your face on the front door and your name
Right.
and everything being, the thing that you're putting out there. So, you know, but dig deep and do it, because the world needs you. The world needs more people doing this work. Um, so the more inroads we can make, the better. But let's not, at the same time, go around bashing our counterparts or other professionals who are really doing a job that we can't do. We can't save people in a pandemic, and we can't, you know, prevent mass casualties. So let's not lose sight of the necessity that Western medicine plays in all of our lives, not just Western medicine, but science in general. We're all sitting here, you and I are having a conversation from two different continents,
Yeah.
across the world, um, by the very same science, brought to you by the MMR.
Right.
So let's not lose sight of the world that we're living in and think that going backwards is somehow going to improve our situation. It's going forward and coming together. So keep, for new practitioners, the more they're focused, I think, on building inroads with the other providers in their communities, including Western doctors. And Western doctors are curious. I
Yes, they are.
I always give my like profession, my PCP or whatever, my card, and say, like, if you ever want a treatment, come in. That's on me. I'd be happy to. And they don't always, but sometimes I've had a few doctors who've come in and had a treatment, or just come by and said hi to see the office, um or whatever the case may be, because they're interested. They want to
Hmm.
know what this is. And I think that Chinese medicine stands alone in our um kind of role in holistic medicine, where you have a complete system of medicine to offer that is not in it's not antithetical to Western medicine. It's actually, there's a lot of tremendous similarities in terms of our approach to the body, our understanding of how the body functions. And so, like, let's just focus on how we can help our patients move forward with whatever it is that needs to happen for them.